Overall, taking a year out of med school was just a great opportunity for me to sort of step back again and look at the big picture for what I'd been seeing, particularly in third year when you're so ingrained in the day-to-day clinical activities in the hospital and in clinics, and to step back and say, what was going on here? What did all these experiences have in common?
This MPH, it sounded like you got access to all different faculty from all different departments. And so what really attracted me to it was the interdisciplinary nature of it.
The year can be tailored enough to your particular interests and areas that you care about that you can get out of it what you want to get out of it.
The MPH year is very different. There's a lot of unstructured free time, and so you may not have that many hours of actual class or hours where you're responsible to be doing a certain activity, but there's a lot of open time that you have to do readings, think about assignments, doing assignments, and work on your master's paper and project.
The MPH curriculum encourages you to find the subtleties and why a right answer may not be right all the time for this population or that population.
MPH years we spend a lot more time in groups discussing. We spend a lot of time sort of thinking and having to communicate ideas in the form of papers and discussions and presentations.
Everyone wants to improve the health of the public, but everyone has different interests, and it's just fascinating hearing about what everyone is passionate about, and then to have these professors that are going to nurture those interests, it's really, really incredible.
The professors really try to give you opportunities to tailor the material to your interests.
They are really helpful and interested in students. They really care about making sure the students are doing well and understanding the material, and they really want the students to succeed. And so that's been probably one of the strongest points of the MPH year.
The faculty are available to you if you have questions about how you're going to incorporate what you've learned into your future goals. And I've been challenged a lot during this year, just in the way that I was thinking.
So the skills that I've learned really act as a foundation for leveraging that degree into roles and opportunities that will place me in a position where I feel like I can really affect the most change.
This year is wonderful for people who are considering a career in academics or a career in something super subspecialized.
Really, I can't emphasize how much I value the things that I've learned and how important I think they are, especially in a climate of political reform, for young physicians to be educated and aware of the larger things going on in healthcare.
I wish that the MPH was a mandatory part of medical school curriculum. I just feel that it's very important for all physicians, clinicians to have this knowledge.
I think that it's a skill set that literally every physician in every specialty would benefit from.
If you want to get out a better understanding of the healthcare system as a whole and what factors beyond symptoms and physical diagnosis go into a patient's health and their decisions, then the MPH year is right for you.